What you see is a knee. What you see is a knee. And one of my friends asked me to talk about Klay's injury. And so I'm trying to tag him. Hey, Johnny, I'm on. I don't know if who's watching, but I'm ready to go. So yeah, so you see this knee. Your knee is a very important joint in the body. Very vulnerable. What is a joint? A joint is basically they call it articulation. It's a place where two or more bones meet together. It's the weakest part of the body. A joint is. Most of your joints are freely movable. Like you have some joints that don't move, like the joints in your skull, for instance. The joints in your skull, they're so tightly joined together that there's no movement. I'm sorry I can't be seen. For some reason, all of a sudden my Zoom is not showing the video. So I'm pointing to myself and I'm realizing you can't see me pointing myself. I'll have to fix that a little later, find out what the problem is. At any rate, it's like those bones don't move. They don't shift. The joints in your ribs, for instance, it's like they're held together by cartilage, and they're so hard. The cartilage is almost as hard as bone. So you would, if you try to penetrate the front part of your chest, you're not going to feel it, and it's not going to easily break because the cartilage there is like really hard, and it joins the ribs to the sternum, which is like your breastplate right there. So some joints are hard, very hard, almost as hard as bone. They're cartilaginous joints. They're made up of cartilage, and they join one bone to another that way. Some joints, or like I said, sutural, like sutures. They're so tightly joined together by small microscopic fibers, you can't even see the joining part. So the bone is so tightly joined together, they don't move. But your knee joint and the joints in your limbs, you heard things like your ball and socket joint and your pivot joint. Well, your knee joint is a hinge joint, meaning it's like a hinge in a door. You only move a door in one direction. Like the door only opens, most doors only open in one direction because it's held together by a hinge. So that's your joint in the knee, and it's one of the most freely movable joints. And so with free movement, when you move, I'm so sorry I can't even show my arm. Like when you move your arm, like imagine you're moving your arm in like those exercises where you move your arm, it's a ball and socket joint, freely movable. That joint has a risk of instability. There's two risks that come with the fact that the bones can freely move. Number one, instability. It can easily pop out of socket because it's moving. And number two, friction. The bones can rub together, causing great pain. So with freely movable joints, you have to have some kind of thing put in place. That's why I believe in a creator. Like, it's like it's designed in a way that you can reduce friction, number one, And number two, you can reduce instability. How do you do that? Well, the reduction of friction is caused by fluid that's flowing throughout the knee. All right, this is a synovial joint. It has synovial fluid. So fluid runs around, moves around, and lubricates the area. Right? Too much is a bad thing, too little is a bad thing. Why? Because you have to reduce friction. You don't want bones rubbing on each other. And the second thing is, are these cartilaginous parts. Cartilage gives it a nice smooth surface, so it's not causing that much friction. So this is what we call articular cartilage. This is your meniscus. Meniscus is hard cartilage, there to protect against friction. All right, very hard, very difficult to disturb. It would take, wear and tear for a long time. Meniscus right here. All right, hey Don, what's up? All right, so to reduce friction, you have cartilage and fluid in your knee to stop the bones from rubbing on each other and causing great pain and heat, right? Okay. The second problem that comes with knees is instability. The bones can easily pop up. So what do you need? You need to have it stable. You have to hold the bones together strongly. You don't want it as strong as cartilage. So I told you, cartilage is next to bone. Like if you feel your breastplate, chest plate, you feel hardness. And that hardness you feel isn't bone, it's cartilage. Your ribs, I don't know if you can feel your ribs and then feel right at your chest plate. It feels almost the same. That's how hard cartilage is. A certain type of cartilage, different types of cartilage, like the cartilage in your ear. Like if you bend your ear, the ear bends. That's cartilage too, but that cartilage is much softer than the cartilage that attaches your ribs to your sternum. And that same cartilage is in your knee area. Okay, hard but smooth, so it helps protect against friction. You don't want ligaments to be as hard as cartilage. Okay, so what is a ligament? A ligament is a dense connective tissue. It's called dense regular connective tissue, meaning it's made up of collagen fibers, which are really, really tense fibers. When you think about collagen, you think about women pumping their face with collagen, right? What does it do? It makes their lips big. It makes their cheeks big. Why? Because their face wrinkles, right? Our faces wrinkle over time with age. And so we want to make our face, strong. So either we inject ourselves with Botox, which will make the muscles tense, but that's more dangerous. So instead of putting Botox in your face to make the muscle tense, they pump collagen in the face to make the face tense, basically to push up the face. Yeah, feel free to ask questions. So basically, there's nothing you can do to prevent this injury using an equipment means like a knee brace or a knee sleeve. What the knee brace does, Johnny, it just makes it more stable. So these ligaments are there to make the femur, which is the thigh bone, connect to the fibula and the tibia. Right? So this is the lateral. So as you say, this is the lateral ligament and this is the medial ligament, right? So these are ligaments. They connect bones to other bones to help it stable. But like I said, with collagen, it's tense, but it's not as hard. So it's easier to tear. So what he tore, so you have, this is basically, right, the lateral collateral ligament, LCL. This is the medial collateral ligament. It's a little smaller, MCL. This is the anterior cruciate ligament, ACL. And this is the posterior. So one is in the front, one is in the back. So that the more ligaments you have one on this side, one on that side, one inside that connects the femur directly to the tibia. And then you have all these muscles that connect to the bones too. These muscles have tendons. So remember I told you last time when we talked about Kevin Garnett, a tendon connects a muscle to a bone, allowing a muscle to move a bone. So it's allowing for movement. A ligament is there to just keep the knee in position. To keep the two bones in proper position, keep the femur right on top of the tibia. So if you tear this, your knee is gonna go sideways. Sorry, I can't even show it to you. I don't know what's up with my video. The knee will go the knee will move sideways. If you tear the ACL, if you tear either the MCL or the ACL or the PCL, you'll have instability. But if you have the two in place, if you have the MCL and the LCL in place, even though the MCL is a little smaller, in place, then even though you tear the middle, the bones can still move. So what do I think is worse? I don't know what's worse. I'm not an orthopedic surgeon. I'm not a physical therapist. I'm just a scientist. Just to let you know my background, guys, just to remind you, I have a biology degree from Oakwood College. I have a master's and PhD in molecular pharmacology from Albert Einstein College of Medicine. So basically, I know how these things are created. I know the substances that they're made up of. I know the process of how they're made, how the cells make them. And then I have a postdoc in neuroscience. But I've been teaching anatomy and physiology for 15 years. All right. So I know I teach and I specialize in the skeletal muscular nervous system. So I know the biology of the biology behind it, how they're created. Different cells create this versus this. The material is different in the ligaments versus the cartilage versus, So, but I'm saying it's easier to tear. It's just, I think if you tear this, the bones totally separate from each other. If you tear this while leaving this intact, these two intact, then there's going to be instability. That's what happens. So what is a tear? This is a sprain. It's a sprain, okay? So fracture is when you break a bone. Feel free to ask me questions during the talk so I can make sure I can answer them. A fracture is when you break a bone. A sprain is where you partially tear a ligament. So all these are ligaments. And a strain is when you partially tear a tendon or a muscle. Exactly, Johnny. Good question. What is a rupture? A rupture is total breaking in half. So that's why Klay was able to run and he was able to jump, which he should not have. This is my beef with the concept of sports. I love you guys. I love your heart. I love what you're trying to prove and everything, but you're making it worse. So what happened in my opinion, with KD was I think, so this is the whole calf. Right? People they never said calf muscle. They didn't say gastrocnemius. They didn't say soleus. They kept saying calf, and that's how they're getting us. The calf is a region, okay? The calf consists of the muscle, the gastrocnemius, the soleus, and and this big ass tendon right here, right? And the Achilles is down here. But in my opinion, I feel like that he strained the tendon. This tendon is different. This name is different than the Achilles, right? So they didn't call, I don't know, but I feel like like if you watch the sports, Shannon Sharp, all of them, they're like, yo, it's always been they keep saying the Achilles, and the reason why they're getting them is because the Achilles is down here. All right, the Achilles is not a part of the calf. They say this is the calf injury. It's up here, right? But if you watch where he was putting his eyes, he was putting it back here, because I feel like they all knew that it was a strain. A strain can be either in the muscle or a tendon, meaning a partial tear. So I feel like he strained it, he tore it partially, and it led to weakness, which ultimately led to the breaking down here. All right. So with a rupture is totally in half, versus a sprain or a strain is a partial tear. All right. So with the rupture, he cut it totally in half. Why am I having issues moving my big screen? Okay. So that's why, sorry. That's why, a torn, it could be multiple levels of tears. He was jumping up and down. That tells me, I'm thinking, I don't know, it's the ACL. So it's in the middle. He had stability on both sides. He had the LCL intact. He had the MCL intact. So since they're both intact, that's why he can run up and down, because the inside is the one that got cut. And it could have been partial. So there are 4 levels of injury to ligaments. A sprain is just a partial tear. A rupture is a total tear that needs surgery. So if Klay doesn't need surgery, well, I don't know. If he gets surgery, it's because they're just overprotective for a sprain. But normally, if you see him resting and it healing, that's just it's a sprain. It's a sprained ligament. So partial tear is a sprained ligament. Part number 2, it's another partial tear. It's just more torn than part 1. It's classification number 1, right? Number 3, it's a rupture. If you have a stage 3 tear, it means it ruptured. It cut all the way through. Surgery is needed. If it's stage 4, that means you got a ACL and an MCL. Like, that's a football injury. That's somebody running into the knee and chopping it. So you tearing it from the side and the middle. That's the worst. So those are the levels. Level 1, partial tear, just a little sprain. That's what I got I think I got in my finger I was talking about last time. And stage 2, a worse tear. It's even more unstable. You can't move at all. As much as, you can move better in part 1. And a complete tear, surgery is needed. That's stage 3. In stage 4, you have multiple ligaments torn. Like this picture right here is multiple ligaments torn. So you ruptured your patella tendon in 2015. I guess you got lucky. I can't take you on the court no more. Yeah. So yeah, that patella tendon is right here. Ooh. So that's connecting your kneecap to your tibia, right? This is like your rectus femoris. That muscle right here is your rectus femoris, and it helps you bend your knee, right? It helps you. I can't even show you my picture. I'm showing you me bending something. You can't even see me, but you're bending your knee, right? And that rectus femoris helps you bend your like basically move your leg. It helps you move your tibia backwards. And so you probably had issues moving your tibia, your leg backwards. Yeah. So that's the difference between a rupture versus a sprain. So it's all about partial tear. So like I said before, I felt like, oh yeah, I got distracted. I feel like Klay shouldn't have been running and trying to prove himself. He's jumping up and down. He's running. He's moving. He's doing all that. He's just further injuring his knee. With every jump that he was trying to show people that, yeah, I'm good. It's okay to be weak, especially with your joints, because the joint is the weakest area of the body. It's the weakest area of the body. It's the most unstable. It's unstable because it's two or three joints attaching together like this knee, and it has to be held stable together. So the stronger your what can give you good stability? Number one, increase your muscle tone. When you increase your muscle tone, those tendons tighten up, right? The tendons, remember, the tendon is when you connect your muscle to your bone. So these tendons tighten up and give stability at the joint. So exercising is healthy. Keep making your muscles toned gives you joint stability, right? A proper diet, you know, so that your joints are nourished properly. Not excessive use, especially as we age. As we age, like you said, Johnny, you know, like I'm playing volleyball. I don't play. I remember when I was playing flag football. So, and that was like maybe 5 years ago. So I was like 35, 36. And I was playing flag football and I'm running, I'm moving, I'm doing good. And then one day, I mean, that ball almost took off my finger. And I don't even think it's really healed properly yet. That's why I think it's injuring so much with the volleyball. And I felt like, yeah, I got to give it up. Got to give up the flag football because I just envisioned my teeth being, I love my teeth. I love my smile. And I just envisioned somebody knocking my teeth. You know, youngins are very aggressive. That's how we were. You know, shout out to Johnny. Johnny's my childhood friend from where I grew up in my neighborhood, and we used to play basketball in his parents' backyard. Like, we were crazy. I never forget. I went skiing. I think I injured myself, and then I came. I don't know if it was with you guys. We went to Park 150 Park, and I had to get taken home in a car. I sprained that knee so bad. Couldn't walk. I was on crutches. You know, it was just a sprain. It was just a partial tear. But because of that, I hardly could walk because I need my ligaments to keep me stable, and even a partial tear. So he should have just relaxed. He should have just let them walk gently out, put you in on crutches, and to give you more stability, not putting pressure on that knee to fully rupture an ACL. So I don't think it was ruptured. I think it was, I don't know what class it was, but the way he was walking, it looked like either a part 1 or part 2. You know, it's just going to take healing. So how do you heal? Like, you heal by, you see this material, I told you the material, it's made up of dense regular connective tissue, like that. Remember that collagen fiber, those collagens? There's specialized cells. They're called fibroblasts. They have to make it. They have to make it inside themselves. And then they make it inside. I gave the example like building a house. Like, you put the cement together. You gotta mix the cement. You gotta mix it first and then plaster it and all that stuff. Well, that's what they gotta do. Just like how we hit the plaster an area, they gotta make it in themselves first. And then what they do is they release it out of themselves. They release it out of themselves, and then they start to smooth it out. They start to smooth it out, and then they smooth it out, and they attach it to the already thing put in place. So since it's partially torn, since something is already there, what they'll do is they'll just put new stuff onto the whatever's there. But if it's ruptured, then they have to surgically attach it back, provide some kind of matrix so that they can actually put everything back together. That takes a lot of time. It's not like when we cut our skin, the cells basically start dividing and growing right back. That's not how ligaments work. Ligaments are mostly non-living material. It's non-living. So the cells can't just divide and replace. They have to build it. And that's the time it takes. And that's what I was saying with KD. It takes time to build it back. And if you don't stay off of it, it's very unstable and it will break. Thanks, Johnny. Appreciate it. I'm glad. And like you said, you're learning this now. And I feel like all our boys should learn this, especially those that are going into sports, so that, like Klay, if he knows, I was watching sports yesterday, it's like the players don't know. It's the responsibility of their medical professionals to let them know. And, if Klay knew, like, if he visually knew what was going on in his knee, I don't think he would be jumping up and down like that. Even if he felt he could make it, right? Even if he felt he could make it, he should have walked gently, let the doctors do what they're doing so it doesn't worsen. Sometimes, this concept of walk it off doesn't always work. This concept of walk it off doesn't always work. So you got to know your body, and you got to listen to your medical professionals, and your medical professionals got to do what's in your best interest for you. All right, I'm gonna stop sharing. Does anybody have any other questions on the pictures? Because I'm gonna release the pictures out. I gotta work on this. Usually, you can see the pictures, and yeah, usually the pictures, my picture above is above the actual picture, but I guess that's just the way it is. It's been nice seeing you guys. Listen, if you need any information on, sports injuries, I will do my best to study up and let you know what I know. I know physiology and anatomy, and I've enjoyed, even though at the misfortune of two brothers with a lot of heart, I have gained respect for Kevin Durant. Sorry, I love Kevin Garnett already. Shout out to KG. I have gained a respect for Kevin Durant, and I don't think he did it because of pressure. I really think he loved the game. And Klay, I think he loved the game. I really believe he loves the game, and he's trying to show guys, keep it hype, keep it positive. He really wanted to play with this team. They both wanted to play with their team. But I really believe, and I'm not trying to disrespect, like, he shouldn't have played. They both would be healthy today if those physicians focused on the injury at hand. And if they keep saying they didn't know, they had no idea, meaning, personally, I feel as scientists, you can always say that, right? If it's not a 50% chance, an 95.5% chance, then it's not statistically significant. I'm telling you, that's their answer. It's not statistically significant enough to be sure, right? But let me ask you a question. If it was a 50% chance that he would rupture his Achilles, would he have gone out? Should he have gone out there? No. But because it's not a high percentage chance, they say, they'll say you have no idea. Like, statistically, you don't. It's true. That's the science. They're giving scientists answers, in my opinion. So yeah, of course, 100%. You don't know for sure if it, but it's a high probability. It was a high probability. Was it 95% probability? Probably not. And since it wasn't a 95 probability, they can say you can still play. But in my opinion, they're playing with words. They're playing with words to ease their mind. But look what happened. 2 injuries, not 1. I said that they should take the Imhotep hope. Imhotep was the first physician, not Hippocrates. I hope they rest well. I hope they get better. I respect their love of the game. Shout out to not my Toronto Raptors. I'm a Knicks fan. I will never claim Toronto Raptors, but I appreciate them for beating The Golden State Warriors. They were exposed. Steph Curry was exposed. Don't put him in the same sentence as Bron. You hear me? All right, I digress. Thanks so much for joining. Thanks for asking me to do this, Johnny. I hope you learned. I'm glad you learned. Have a good night, guys.